So good evening, everyone. Thank you for joining today. Today is International Epilepsy Day, as most of you would be aware. And the theme this year was that epilepsy is more than seizures. So that's what we are focusing on today. And we will introduce our panelists in just a moment. A quick reminder about Patients Engage. We are an online platform operational for over 6 years and focused on evidence-based and holistic management of chronic conditions. As most of you are aware, we focus a lot on the perspectives of patients and family caregivers and believe in the value of lived experiences. We do believe that if you are more informed about managing your condition and proactive about it and engaged about it, you will feel empowered and you will, make better decisions and therefore leading to a better quality of life. As some of you are aware, we've been doing these regular webinars for a long time now, and they allow you to interact with healthcare professionals as well as experts with lived experiences. So today we have with us Dr. Pradnya Gadgil, who is a consultant pediatric neurologist at Kokilaben, Dhirubhai, Ambani Hospital. And she has, I think, an intense focus on epilepsy, very passionate about the topic. And we have Yashoda Wakankar, who lives with or has had epilepsy for a long, long time. She'll talk a little bit about it. And she's also currently a neuro counsellor in Pune with the Dinanath Mangeshkar Hospital, as well as she runs a foundation, Samvedna Foundation. So she's very active in running support groups in Maharashtra. The moderators for today are Dr. Sheetal Patel, my colleague, and I'm Aparna Mittal. I'm the founder of Patients Engage. What we will talk about today, we know that epilepsy affects people typically when they are young. There are a few cases of adult onset as well, but most of the time it is when they are young and it impacts their lives in many different ways. So we will briefly talk about what is epilepsy, how it affects a child's life, and as they grow older, what are the changes that happen. How do you communicate about the condition to the school? Do you talk about it in the workplace? Effect on your learning abilities, your memory, and we'll also be talking about challenges with respect to marriage and relationships, how it evolves with age. Um, we'll touch upon pregnancy because we may not have too much time, and we'll also address the question of whether surgery is a treatment option. And as always, I think it's important, it's a guidance to the attendees that the information being discussed here is based on experience and it's not to be taken as specific medical advice. So if you have specific issues, please do consult your doctor. This session is being recorded, and if you're logged into Zoom, you can post your questions as in type your questions on the Q&A. If you are on Facebook, you can post them on the live feed and we will pick them up. As always, you can write into us at editor@patientsengage.com and follow us on the website or any of our social media pages. We are on Facebook, Instagram, Twitter, YouTube as well. So, a reminder that the more we share, the more we learn from each other and we can inspire each other to be better in terms of managing our condition. And a quick reminder for people, if it's of interest to you or your friends, on Thursday, 6 p.m., 11th February, we're also doing a topic on loving through cancer, Valentine's Day specials. So if you can just let people know. Okay, I'll stop the share and get started on the discussion. So again, if anybody has a question, you can start entering whenever you want in the Q&A and we'll take them as it goes. Dr. Pradnya, could you very quickly tell us what is epilepsy?
So if you have to look at epilepsy very simplistically, what epilepsy constitutes is a person having a tendency to keep getting seizures again and again. But then what are seizures? So seizures, again, looking very simply at it, if you understand that the brain is like a very intricate circuit board, and sometimes there's a short circuit, or certain circuits don't work the way they're supposed to be. If that happens, then the short circuit in the brain manifests or is seen outwardly as a seizure. And it's called 100 things. It's called a seizure, fit, mirgi, akri, dora, jhatka, lot of names in the colloquial languages. But if you get a seizure like this when you're unwell, say your calcium is dropped, you're little and you have low calcium, you're old and your sugar is dropped, or you've had a road traffic accident and a head injury, even then you can get a seizure. And then it just means that there's something not right with the brain and you know what it is. Those seizures do not constitute epilepsy. So which are the seizures which, if you keep getting again and again, we call it epilepsy, are the ones which are unprovoked, i.e. there is no trigger, there is nothing wrong. Typically the patient is all fine, you are at work, you are at school, you may be playing outside, everything is hunky dory. Suddenly there is a short circuit out of the blue, and you get a seizure. And then if we see that that particular person, a child or adult, has this tendency to get these unprovoked seizures again and again, only then do we call it epilepsy. And I think this is important, because very often a single seizure and the biggest worry in the family's mind is this epilepsy. And
Right.
just important to bear in mind that may not be.
Right. Thank you. Thank you, doctor. And when do you see onset of epilepsy typically? Is there
Um,
a typical timeline for this?
So epilepsy as a rule can occur at any age. You can have a day-old baby having seizures because of epilepsy, and it can, carry on well into geriatrics. So the start or the onset can be at any age. But there are certain hotspots. So the hotspots along the timeline, of age, are the first year of life. Typically the most severe, difficult to treat epilepsies, very often genetic or because of brain malformations, will start very soon after birth, or definitely in the first year of life. Then it's around 4 to 7 years of age. A lot of simple genetic epilepsies will start around that time.
Hmm.
Then around adolescence, a lot of genetic epilepsies which will continue well into adulthood will start in adolescence. And then it's a geriatric age group. These are the hotspots. But epilepsy can start at any age. It's not restricted by age.
Right. Okay. Sheetal, jump in whenever you want.
Sure.
Uh,
Um,
Go ahead.
so I guess this is a question for Yashoda. How does the epilepsy affect a person's life?
Yes,
And before you answer that,
mm.
Yashoda, can you just give a quick recap of yourself, as well as how long you've lived with epilepsy, so that it sets the context a little bit?
Okay. Hi, I'm Yashoda, and I always share that I have lived with epilepsy from childhood. My epilepsy started when I was 7 years old. I have lived with epilepsy for 23 years, and 15, 16 years back, I went through the brain surgery, and after that, I'm absolutely all right. Um, when my surgery was done, and after that, I was thinking that I'm so lucky that there are no problems, etc. And but I saw children were playing in the ground, and I just remembered that one of them, the boy had epilepsy, and that was a turning point in my life, because I started realizing that there are so many people in India who are still having epilepsy. And I was the lucky one to have doctor parents and so on. But there are so many people who cannot afford the medicines, or who are not aware about epilepsy. So that was a turning point when I started epilepsy support group, and our support group's name is Samvedana Foundation. Our group is based in Pune. However, we help all over Maharashtra to start a new support group, or for the counseling and for many activities. And the main activities we are doing are epilepsy support group, epilepsy counseling center, epilepsy marriage bureau, epilepsy matrimonial meets, and medicine help for the needy people with epilepsy. So that's how
Right.
I will tell about myself.
Sure. Okay. Now to answer Sheetal's question, how does epilepsy affect a person's life?
Yes, it does affect, because whenever the seizure occurs, whenever epilepsy gets started, then first question in mind is why me, and why this has happened in my life, and what is this, and why I do not have control on my consciousness, why getting this seizure, and see, there are some prestigious diseases like heart and diabetes and so on, but there are some diseases and disorders which have so much of social taboo. So epilepsy is one of them, and because epilepsy has a huge social taboo, and that's why we never talk about epilepsy. Nowadays we do, however, a long time back or even 10 years back, no one used to talk about this, and this social taboo is there, and that's why when as you have asked that how does epilepsy affects a personal life, so it affects a lot, because it affects psychologically, psychosocially, and parents also have a lot of beliefs about epilepsy, even if they are educated and so on. They are not still not aware what to do and what not to do. They
Mm.
still try to hide it, and that's the worst thing, because we in our support group we always tell to the parents that they should share about their epilepsy in the relatives, in the school, or to the neighbors and so on. Or if they hide, uh, there are so many bad things can happen, that if their child would get seizure while playing, no one would understand what is this happening, and what to do and what not to do. So it does affect a lot of a
Right.
person's life, I believe.
Right. Okay. Thank you. Thank you, Yashoda. So you mentioned that it is a good idea these days to inform your school once you're diagnosed, right? And Dr. Gadgil, is there a medical certificate that is given? What is the process, Dr. Gadgil?
I so support what Yashoda has just said. Epilepsy in our country is not only a medical problem, it's a social problem.
Mm.
If you look at it medically, there is so much we can do about epilepsy. And again, you have a epilepsy warrior Yashoda story here, as proof. It just a lot of common sense to tell everyone around you, especially when it's kids, all the responsible adults in that child's environment, that they should know that the child has epilepsy, so
Right.
that they can react the right way. uh, the social problem isn't only restricted to it being a taboo. It also involves people reacting very wrongly when a person has seizures, and
Mm.
that really causes a lot of problems with respect to patient safety.
Mm.
So it's important that all adults, not just school teachers, tuition teachers, babysitters, grandparents, whoever is looking after the child, the bus didi, in Pune, Mumbai, you have school buses, the bus didi, the bus attendants, they should know that the child has epilepsy, and they should know the first aid required. So what I have done at our hospital is I have an A4 sized sheet which talks about first aid in 5 sentences and a lot of pictorial cartoons. A lot of it, first aid is what not to do rather than what to do.
Mm.
And Plus, we encourage the problem is it's not standardized. It's not that it happens everywhere, but what we try to do and what we do through our support group as well is that we have a format which has just 3 questions, saying the contact details of the parent, name of the doctor and the hospital, what are the type of seizures, and is there any specific first aid that a child needs. Remember, every seizure doesn't need first aid. There are seizures where a child just goes blank, and
Right.
many people may not even pick up that a seizure has occurred, forget having to give first aid.
Mm.
But then it becomes a safety issue. If the child's swimming or doing gymnastics, then those seizures can cause concerns with safety. A first aid, a generic first aid leaflet, and a specific letter just about the seizure types of that child, contact details, and any specific emergency precautions is what we give every child. But like Yashoda said, the chance that the parents will hand it over to teachers, that parents will feel enabled to talk about this to everyone concerned, is a far shot.
Right.
So that's the bridge we need to cross. It needs to be, it shouldn't be a taboo. Just like you talk about diabetes, you'd say, okay, I have epilepsy. It's a very natural thing. So that shame, that taboo aspect has to go away.
Right. Right. And Yashoda, so far in your experience over the years, when parents do inform the the family members or the school, etc., does this impact treatment towards the child? Are you hearing about experiences there on that? And are schools currently more equipped to handle children with epilepsy?
Yeah, I will answer the first one
Mm,
first. That yes, that it is always important how parents are looking after it. It is always important how confidently parents are telling about epilepsy to others.
mm,
And the person with epilepsy, it also depends how he or she is telling. Like if I tell about my epilepsy in very inferior way, of course people will look at me in that way. However,
mm,
I have to tell, yes, I have epilepsy. I used
mm,
to tell that in my childhood. Wherever I used to go, I used to tell that I have epilepsy, and if I would get the seizure, please don't do this, 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 this. I will handle myself, because I never used to fall down.
mm,
So these things, it has to start from the person with epilepsy. I did this from the year when I was 7 years old. So role of parents is very important for this, how they are telling their children, that how you should tell others, and how parents are dealing with this is very important.
mm.
And sorry, what you asked after that?
Uh, the second question was, are schools better prepared to handle this these days? Are you seeing
Yes,
an
yes.
improvement? Right.
Yes, there is some improvement, because now there is a law that schools cannot remove for this reason. If children have epilepsy or any other disability, schools cannot remove. But unfortunately, there are schools, they tell some other reason,
Mm,
and or they do not give admission, or they refuse the admission, or so on. And then uh, that is also happening nowadays. But it has to be we wish to make a huge school awareness program. And what we have planned is to take the all the schools online meeting. Nowadays it is easier
mm,
to tell about epilepsy, and about how to handle the children if she or he get the seizure. And school counselors are also not aware about this. They are counselors, but they are not aware about epilepsy, and they are not aware how to counsel a child with
child with
epilepsy, or
epilepsy.
parents. So the children or parents, they bring their children to us, and they feel very sorry that that counselor was not aware about this. So I also want to, I always also wish to do that, that I need to tell those counselors that about the epilepsy, and I wish to take their sessions.
Right, right. Okay.
Can I come in here?
Sure, sure,
Sure.
sure.
So through Samman, this is a, as a practicing pediatric epilepsy doctor, this is a huge challenge that schools react to it not quite the right way, and that's because of lack of awareness. I don't
Mm,
think there is any ill will there. So we ran a campaign pre-COVID. We went to about 50 odd schools and
mm,
did a questionnaire just to understand before the talk, before the awareness talk, saying what is the baseline awareness levels amongst teachers regarding
mm,
epilepsy.
right.
I'll only tell you one data point.
Mm,
85% of teachers ticked that yes, put chappal or kanda
mm,
as the first step in first aid if a child has seizures. And I think is a
Right.
phenotype of that lack of awareness amongst teachers.
mm,
We are right now doing this with the BMC, the Mumbai Municipal Corporation. We are in the process of educating their whole 10,000 teachers, and we're doing it online. And there is no difference in awareness in BMC and private schools. I think after all, teachers are you and me, they're part of the
right,
society. So they just reflect the level of awareness regarding epilepsy.
right.
Yeah, and I'm sure this will go a long way. We just have to keep egging on.
Sure, sure. Thanks. Sorry, Sheetal,
Does the
yes.
same thing, yeah, does the same thing apply for informing workplaces? when the young adults, get their jobs and at least their first jobs, do they also do that?
Is this for me?
Anyone? Yeah, Yashoda, go ahead.
So before that, I guess question to you, Dr. Pradnya, do the intensity of seizures reduce over time? Or, is it just that the person becomes better equipped to handle it as well? And therefore, how does it change the need to inform the workplace? I think if we can look at it that way.
So majority epilepsies, about 70 to 80%, once you get the patient stable on a medication regimen, and once things have settled, the medication is suiting the patient, there are no side effects, they're taking it regularly, typically seizures will be well controlled. You might have a one odd seizure which you call a breakthrough seizure. There's a little bit upar niche, it's biology at the end of the day. So you can have occasional breakthrough seizures, but majority patients will be well controlled. Those who are surgically remediable will be offered surgery. So you are sort of looking at a very steady state, even if the epilepsy is not gone away, not cured. Even in majority of those patients, you're looking at a very steady clinical course that you're taking medicines and the epilepsy is under control. That, however, does not take you away from the need to inform the workplace, because the biggest challenge is that seizures just happen out of the blue. I phone karke nahi aate hain, unfortunately. So people around you have to be aware to react correctly, to do the correct first aid. And very often, not knowing, saying, oh, you never told us, just causes a lot of trust issues with whoever it is you're dealing with, and the practical problem of the wrong first aid. Also sometimes we might say that people with epilepsy shouldn't be given jobs where they have extremely irregular work hours and so on. So in that case also, it would help to inform, attach doctor's letters wherever you want, so that that's taken care of. They get the confidence that yes, it's not going to be a problem, it's not going to be a hazard. People often think it's contagious and that other employees can be at trouble, or it's something to be shameful of. So just talking to them, getting enough medical letters can actually go a long way. But I think you should always inform, even if your epilepsy is well controlled.
Right. So I think you touched on it, and there's a question on Facebook as well, is, do we know before getting a seizure, and how does someone prepare for a seizure and control it?
So there are types of seizures, and the seizure types would, grossly speaking, is the seizure short circuit involving all of the brain, or is the seizure short circuit only involving part of the brain? The seizures where the short circuit happens only in part of the brain, the patient often gets a warning, what we call an aura. The patient comes to know, and just like Yashoda said, she knew that a seizure would be coming. Those are the times where they can go sit down, or stop where they are, get to a safe place, and don't necessarily need a lot of first aid from bystanders. But the ones where the popular seizure type, which people think that's the only seizure type, where you fall down, there's jerking of the whole body, a very visually very dramatic seizure. There's frothing, sometimes you might bite your tongue, sometimes you might wet yourself. So those are the seizure types where very often the wrong kind of first aid happens, and those are the seizures which disturb the onlookers a lot.
Correct.
But in those seizures, the patient themselves forget getting a warning, may not even know that he or she has had a seizure at the end of it. Might just find themselves on the floor surrounded by people, and only then realize, oh, I possibly have had a seizure.
Right.
So it's not one size fits all, which is why that information saying what are the seizures in that particular person, I think that information is very helpful. Also remember, the circuit is very robust. So if a given individual gets a certain type of seizures, typically you always would get those type of seizures. So that information is really very practically also very helpful to be communicated to people around.
Right.
Can I add my point into this?
Sure.
Yeah. We were talking about aura, and the sensation we get before epileptic seizure. So I will tell my experience here that when I used to get the seizures, I used to get some tingling sensation in the throat. So that was an aura. And not only that, but just a sensation that now I will get an epileptic seizure, or feeling little low. Then
Mm.
that is also one sign. Now, I use that aura for my meditation. I mean, so I always ask this question while counseling, that do you get any aura? Because that is very important. Uh, I started doing a kind of meditation that is called as vipassana. It is all over world. So I used to go for vipassana, and there was one line that please observe the sensations.
Mm.
So when I was doing vipassana and that line was going on in the tape, that please observe your sensations. And coincidentally, that time my epileptic seizure started. And the first step was I got those tingling sensation in the throat. So that was the moment when I started observing my sensations. And that was the moment when I just observed it as a third person, the mild seizure stopped.
Mm.
That was just aura, and then it stopped. So I was so happy that I can observe my epilepsy, I can observe my aura. So what the point I wanted to add here is, your mind is very important while living with epilepsy, of course, while living with any other disorder or in normal life too. So how you look at your epilepsy, or how you look at yourself, is very important while living with epilepsy. So I started looking at my epilepsy as a third person, and I accepted it. Yes, it is there, and I'm going to live with this. So
Mm.
that acceptance helped me a lot to live with epilepsy. So that aura was the sign which I used as the sensation.
So when you sensed that there was this tingling sensation, etc., what could you do to, uh, I guess, take yourself out of harm's way or whatever, right? So what was your reaction to it once you started observing that?
It was helpful for my mind, because whenever a person gets seizure, when the seizure is getting over, when the person is getting into normal, the thinking process again starts. And that thinking process is, oh, where I am, यहाँ कौन है, कौन देख रहा है, मुझे क्या होगा. और ये सब डर जब बढ़ जाता है तो दूसरी सीजर आ सकती है. So uh, when your mind is balanced, and when you look at it very patiently, then this will not happen. The fear thing and anxiety will not happen if you are balanced. So that
Right.
aura and these things happen. Of course, I could never stop my seizure every time. It is not in my hand. But
Mm.
at least it helped me to look at my seizure positively.
Right. Right. Um, Dr. Pradnya, does epilepsy cause, learning difficulties or memory impairment? And is that common?
So epilepsy by itself causing learning issues is unlikely.
Okay.
They're very rare epilepsies, which we call an epileptic encephalopathy, which can cause learning problems. But do see learning problems. We do see issues with concentration, memory, very commonly in people who have epilepsy. So
Mm.
what causes is whatever's causing the epilepsy. So remember, epilepsy is like fever, right? You get fever in malaria, you get fever in TB, you get fever in COVID. It's a
Right.
it's a symptom complex. But what causes epilepsy often is the two big etiology or causative groups are. One is if your brain's injured because of some reason.
Mm.
Injured as in you've around the time of delivery. The commonest thing we see in India is around time of delivery, if the child hasn't had enough blood or oxygen supply, it's been a difficult delivery in a small place, hasn't received the resuscitation, or has had infection, meningitis, sepsis, very common again in our country, or has had low sugars because the feeding practices aren't appropriate. So anything that has caused injury to the brain, and this is just one example around the time of birth, because that's the, I think, the commonest substrate in a country like ours, where our perinatal mortality, morbidity care still leaves a lot to be desired.
Right.
But if your brain has had injury at any point, you've had a big road traffic accident, you've had, say, TB at some point, and there are scars left behind in the brain. So those scars, those injury can give rise to epilepsy.
Does stroke also
Those
cause epilepsy?
Good. Yeah. So
Good. Okay.
if you've had an old stroke,
Mm.
and then the scars sort of mature into an electrical circuit which is wrong, only then, not necessarily again every stroke.
Right.
So it's brain injury. That's a past brain injury. That's one big reason, and the other big reason is genetic. So if you have genes which are sort of programmed to cause short circuits, those are the genes which also can cause problems with memory and learning and all of that. So it's not epilepsy, but often learning problems go hand in hand with epilepsy. And a large part of our work is not just to look at epilepsy, but also to look at other functions of the brain,
Right.
and try and help out the patients in those as well.
Right. Okay, I think there's
So
one.
I think the
Yeah, go ahead. Go ahead,
sorry,
Sheetal.
think the question was, do these children do have issues at school, and do they go through, all?
I think we lost your audio, Sheetal, for a bit.
Am I on mute?
Yeah, no, you're not on mute, but for some reason the audio just disappeared.
Okay. So do these children have difficulties going through education in general? You
Um,
did mention learning difficulties, yeah.
Yeah, so not in general, not as a rule. I think every patient we check, and we check from very early on, depending what age, whether the initial developmental milestones are normal, are they progressing like other kids. So typically each follow-up appointment, apart from the epilepsy, we are checking how's the learning going according to the age, whatever is expected. Idea being to try and catch problems very early on. So for example, if the problem is with IQ, then you are looking at a different way of educating the child. Remember, mainstream education is not the only way to educate. Education is to get the child independent as much as they can when you grow up. So you're looking at IQ, you're looking at learning difficulties, in which you can stay in main school, mainstream, have flexibility around the way the child learns. If there is keep looking for concentration problems, very easily sortable. There are medicines, occupational therapy, so on and so forth, can help concentration problems. So you're always checking for these three main headings. But it's not a given that a person with epilepsy would have issues, but it is seen very commonly in association.
Right. And
And
do
it can range.
medications cause any side effects in terms of learning or memory or whatever?
Yes and no. So the older medicines, though they were very effective in controlling seizures, really would and have proven to be causing problems with cognition. So the child would outwardly look very dull, drowsy, not the most alertest of people. But the medicines now, they are extremely well tolerated, to the point that now when parents look at me very anxiously, I sort of challenge them saying, listen, I'll make your child stand in a line with his classmates, and I can promise you nobody will be able to interact with those kids and say, oh, ye bacche ko dawai chalu hai. So the newer medicines are extremely well tolerated. And say in a given patient a medicine doesn't suit that child, there are a lot of options. You can change the medicine to
Right.
try and suit the child. So the cognitive issues, the memory problems with the newer medications are really rare.
Right. Right.
I would like to add into this
Mm-hmm.
that parents and people with epilepsy, both of all of them need counseling. And in India, counseling is most of the time it is ignorant. However, nowadays doctors have to refer, uh, doctors have to tell these people with epilepsy and their families to go to the counselor regularly, because
Mm,
it helps a lot, since they have so many misunderstandings in their mind, since if there is some learning disability or anything, but they need counseling. So I always tell this thing because it is very important from my perspective.
Right.
No, that's that's very true.
Yeah.
But there is a taboo around counseling also.
mm,
In fact, I
Yes.
had a little kid who was looked like she was doing very well, and the child herself was extremely well adjusted. मैं खुद दवाई लेती हूँ. Mom doesn't even have to remind me. 8 standard. And I said, but the parents weren't handling it well. So I said, let's why don't you meet our counselors? The child got so upset because her association was counseling means I have a huge problem,
mm.
which is why. So so even counseling is a huge taboo. But yeah, so that I think that's where the support group meetings help.
Right,
I think the concept of counseling also needs to mature in our society. Yeah, yeah.
right. Somebody's asked again, are there tips to control seizures? Like, should I hold on to an iron item? So,
I I wish. But there are a couple of very important things that you can do,
yeah,
and I know Yashoda will definitely add to it. But me just coming as a epilepsy doctor from point of view, two very important things. One is, please take your medicines on time. If there is a problem with it, with the timing, or sometimes the taste in the younger ones, or they're not suiting you, they're not available, you can't afford them, there is help for all of these issues. So do go back to your doctor, talk about it, but make sure you're in a position where you are able to take medicines regularly. That's medicine like that wall which stands between your short circuit and a clinical seizure. The second thing is just having a regular lifestyle, of which a regular nighttime sleep is probably the most important thing. And is it only important for children or people with epilepsy? No, it's important for all of us. If you want
mm,
your brain to be serviced and to be working optimally, just like your car, it will only give you a good average, will be reliable only if you've done servicing. That's exactly what happens to the brain in a right kind of sleep. Now,
mm,
sleep means you have to sleep at about 9:30. And I know people look at me saying, is she out of your mind, out of her mind, especially Mumbaikars. um,
mm,
People don't reach home before 9 o'clock, forget getting into bed. But at least for your kids, if you can get that done,
mm.
that they sleep at 9 o'clock, then they have to wake up at 6 7 to study whatever works. But that
Right,
our brains are programmed genetically to go through phases of sleep,
right,
which does a lot of good for our brain. But then that sleep has to start at 9 o'clock, and then you have to get 8 10 hours of sleep depending how old you are. So the second thing apart from medicines is a good night's sleep. So not rocket science, unfortunately.
right. A couple of questions on the chat on Zoom. One is a patient asking, is epilepsy genetic? She was diagnosed when she was 8 years old, had no previous trigger. And she also says that her doctors told her she can taper the medicine, but she's scared. So, so yeah, if you can address those two questions.
So yes, epilepsy can be genetic. That's one of the commonest causes of epilepsy. um, uh, Remember, a genetic doesn't mean inherited. Many people misconstrue genetic as being inherited. All genetic means is your genes are programmed in a way that you have a tendency to get seizures. If your doctor has said that you are able to come off medicines, that might very well be true, because we know that some genes are age limited. So that programming works only up to a certain age, and
Mm,
then we are actually able to take patients off medicines with a very very less risk of seizures recurring again. When do we say that the patient is in what we call terminal remission, matlab absolutely almost zero chance of seizures recurring, is 8 years after you stop medicine. So everything in epilepsy is long, the timelines are very long. But doesn't but if you can't just continue on medicines because you're scared of the epilepsy. If there is reasonable evidence to suggest that the tendency is gone away, then it's absolutely the appropriate thing to try and come off medicines.
Okay.
Yashoda might want to add something there also about the lifestyle in
Yes,
epilepsy.
I will not add about medicines. However, I will add about the lifestyle. I think our lifestyle is very important while living with epilepsy. And that's why in our support group, we arrange the meetings and where we keep the topics such as yoga and epilepsy. So, as I said earlier, that exercise, any kind of exercise which suits you, is very important for for all of us and for
Right.
people with epilepsy. So, yoga and epilepsy also helps. There are so many researches done on this topic, and so we have seen those researches, and we encourage them to start doing yoga, even meditation, any kind of meditation they want to do. Meditation also helps to keep their mind balanced. Then again, we called once a dietitian, and she talked about diet and epilepsy. So how your balanced diet is important for epilepsy, so that is also very important. So we have to keep our holistic approach, and not only medicines, of course medicines are important, but other than medicines there are so many things which we can do, that we have to do. But we see in India that people run after only medicine. But सिर्फ मेडिसिन लेने से आप ठीक नहीं होते हैं, आप वहाँ कैसे देखते हैं, आपकी लाइफस्टाइल कैसी है, ये भी बहुत इम्पोर्टेंट है. So that's why I think that your lifestyle and your perspective, your positivity in your mind, your environment and your family, all these things are very important while living with epilepsy. And that's why when someone asks the question that ये कांदा चम्मच ये वो ये जो रहता है, so these things are not important. It is very important. And your positivity in your mind, the environment, your family, and the regularity in your medication is very important while living with epilepsy.
Right. Okay. Thanks. Let's talk about. We talked about childhood. We talked about lifestyle. Let's talk about another difficult topic, which is marriage, right? And Yashoda, you do a lot of work in this space. So, what are the challenges that you see in terms of the whole topic of marriage?
See, in Indian arranged marriage system, we know that it's so difficult to get married for the normal girls and boys too.
Mm,
So, so arranging the marriage is not easy
mm,
in through the arranged marriage system. So when someone tells the truth that yes, I had epilepsy in childhood, no one will go ahead. Or even if boy or girl, anyone would tell, it will not happen easily. So when we started our support group in 2003, so at the same time we started our counseling center, and so many youngsters started coming to us for this topic, that should we tell about our epilepsy while getting them married or while arranging the marriage. Sometimes parents came with their young children, and they also asked that what should we do. And
mm,
there were some cases that parents told us that they told about their daughter's controlled epilepsy, and the other party was not aware of that word epilepsy, and she got married, but later her mother-in-law told to stop the medicines, etc., and they got divorced. So then we saw so many cases like this, and then we decided that we have to do something on this, and that's why we started epilepsy marriage bureau. So that was very unique idea. So first we met all the neurologists in Pune and we discussed with them. So they said yes, person with epilepsy, normal situation, a person with epilepsy can get married.
mm,
So then we started our epilepsy marriage bureau. So when I wrote an article in newspaper, I got more than 50 phone calls from all over Maharashtra, and people started sending us letter or coming to us and registering their names. So the lesson we learned was people also started bringing their slow learner children of the marital age. So
mm,
and then we made this rule that we do counseling first, and we see the person with epilepsy, the capability of the person, and then we decide shall we allow him or her to register the name in our marriage bureau. And we also see all their papers, and if the epilepsy is controlled, if person is normal, then only we allow them to register their names. So when we started it, there were 100 girls, 100 boys, and then it started. And then we started thinking what should be next. So then we arranged epilepsy matrimonial meet, which was in 2008. That was the first epilepsy matrimonial meet probably. And then also 20 boys and 20 girls, and with their parents, they came, and the introduction session was going on. And then we started this arranging this epilepsy matrimonial meet every alternate year or so. Till date, we have arranged 30 epilepsy matrimonial meets, and till date, we have arranged 29 marriages, and all of them are living with controlled epilepsy. And see, when we counsel them after marriage, when they come for the sharing in the matrimonial meets, they always share that they feel so comfortable with each other because they do not have any fear about epilepsy. Otherwise, they had that fear that who will understand me, who will understand if I would get a seizure, or who will understand why I have to take medicines every day. So since both of the families are aware of the word epilepsy, they can understand each other, and even husband and wife, they remind each other for the medicines, and they take care of each other. In our group, one lady was sharing that she said that once her husband got a big seizure and he got admitted, then she took care of him because she knew very well about epilepsy and so on. And then that boy, he was telling us that because of that incident, they came very close again, because they were very caring for each other. So these things happens, and this activity is going on. uh, so that's how it is. And we nowadays we do it online as well. This year, in last month, our matrimonial meet was online. That was the first time. And we do registration online as well. It's
Aparna,
unmute.
you're on mute.
Sorry. Dr. Pradnya, one question that keeps coming up is on pregnancy and people with epilepsy, right? So if you want to talk us through that, is that advisable, not advisable? What measures?
So epilepsy is a slightly tricky time for multiple reasons, even without epilepsy. There are two areas of concern around epilepsy. One is before the lady becomes pregnant. Is there a chance that this epilepsy is going to be inherited, passed on? So nowadays we are able to do genetic tests, and if needed, and determine the chances of the offspring having the same epilepsy, and even alleviate it. There are ways to go around it so that we can ensure that the child who is born doesn't have the epilepsy, only if it is inherited, which is rare. Inherited epilepsy is rare. The second area of concern is the lady's epilepsy in and around pregnancy. So very often people stop taking their medicine suddenly because they've gotten pregnant. Don't tell the obstetrician that the lady's has epilepsy and is on anti-epileptics. So if you get a seizure when you're pregnant, remember it can cause problems to the fetus as well, because the metabolism for that time gets affected. So it's very important to not stop medicines when you're planning a child during that conception period and throughout your pregnancy. Now, the worry amongst a lot of us is that certain anti-epilepsy medications can cause side effects on the fetus, on the baby. So again, what we typically do is, if it's a girl who is if we diagnose her with epilepsy, and there's a chance that will get pregnant in the near future, we start having the dialogue very early on. choose medications which have the least chance of affecting the fetus from very early, from right from the beginning. But if it's an epilepsy which is started in childhood and you're on medications, then sometimes you choose to change the medicines if the ongoing medicines are known to cause problems to the fetus.
Right.
But there is, as long as these aspects have been taken care of, that the epilepsy is well looked after, the anti-epileptic medicines are such that they have the least chance of causing harm to the fetus, and you've looked into whether it's an inherited epilepsy. I think as long as you've taken care of these three aspects, then there's so many women who've gone ahead through a successful pregnancy, have had children who are doing well. So it's very doable, but just needs a little bit of extra thought and planning into the whole thing.
Right.
Yeah,
Yashoda, you
I
want to
will
add?
add, yes.
Yeah.
In our epilepsy marriage bureau, what we tell the girls and boys that if they are thinking to get married, then they should go to each other's neurologist and with the families, and they should understand each other's epilepsy. They should hear from the neurologist, and then they should take the decision. And we also tell them, both of them, to go to the gynecologist, because
Mm,
nowadays even normal couple also do this, that going to gynecologist is useful, always useful, helpful.
correct,
So
correct.
so we tell them to do that, and to tell about epilepsy, and if gynecologist would tell to add some vitamin or anything, so they should do that. So these things also helps, and positivity.
Mm. Right. Chital, anything that you want to ask? Just go through the
I
questions.
just wanted to ask, yes, I think any particular social challenges that you are seeing, Dr. Pradnya, in the urban, cities for parents and children?
My God, I can start and not stop.
I glad.
Yeah, I mean, like we said, epilepsy is a social problem,
Right.
my background is I trained in UK, and now I'm back in India for 10 years. I'm very proud that when it comes to medical treatment of epilepsy, whatever cutting edge work gets done abroad, we are able to do all of those, and I'm incredibly proud of that, as an Indian. But the similarity unfortunately ends there. The minute my families, my patients step out of the clinic, the way epilepsy is perceived by the family, yeah, and starts, like Yashoda said, it starts with the parents. It's not
Right.
uncommon for parents to keep coming back and asking me, dawa kab band hoga, dawa kab band hoga. They're looking at the dawa as a problem, not as a solution. And that, just that question tells me that they're looking at the epilepsy sort of is very omnipresent in their life. It just affects, rules, colors the way they look at their own life, their child's life. And then that undoubtedly spills over into how the grandparents look at it, how everybody around the child looks at it, schools. In fact, kids look at it the best way. Kids just look at life black and white. They accept, okay, I have this bimari, they're like, okay, dawa leni hai.
Yeah.
If you explain to them in
Yeah.
simple terms, they actually do a great job. But then keep wondering, why do mom and dad tell me not to tell about epilepsy to my friends? Why do they not let me go for sleepovers? Why am I not allowed on picnics? And that is when that idea gets sown in, saying I'm different, there's something wrong with me, my parents are ashamed possibly because of me, leading to a lot of inferiority complexes. Very often a lot of patients come off medicines, and I say, don't come and meet me, you're all sorted, you're cured. But I want sweets after your 10th and 12th ka results or whatever entrance exams are giving. And you often see them underperforming. We've checked their IQ, we know there is no learning difficulty, but somewhere you don't see them fulfilling the potential that I think they could have. And I think what stops them is this whole thing in their mind, in their parents' mind, that ये अलग है, इसको पुश नहीं करना है, छोड़ना नहीं है किधर. They can't apply for colleges, they can't apply for the best college because they're worried about what will happen if he or she has a seizure. So it's like the social challenges are literally at every step in life, and I think it all is because of the way people look at epilepsy. They let it color parts of your life where it doesn't need to be so. um, and you know, and I'm not talking out of thin air. I mean, you've got Yashoda here, an incredibly successful person living with epilepsy. You want to look at celebrities, we have very few Indian celebrities. I think most Indian celebrities don't talk about epilepsy, but Jaunty Rhodes, every cricket lover will know Jaunty Rhodes. He is the epilepsy ambassador for South Africa. Recently Abhinav Bindra declared that he had active epilepsy. So there are many, quite a few people, so many Olympic gold medalists. So epilepsy doesn't need to, medically speaking, strictly medically speaking, doesn't need to be an impediment in your career or your sports or your hobbies or whatever else. But it
So I
does.
think you bring up a good point, because just recently we were translating some of our English content on epilepsy to Hindi, and all the examples were, Einstein and Jaunty Rhodes and all of those. And I'm like, I actually did a search to see if any Indian famous person has gone public with whether they have epilepsy or not. So I
Yeah,
think
there is.
there is.
Yeah. Ketki Chitale, she's actress, and
Okay.
she has epilepsy. She has active epilepsy, and she
Okay.
always talks openly about her epilepsy. And she uploads about her speech about epilepsy in every week. So on Facebook, on YouTube, and she's very active. And one more friend of mine, she's Manaswini Lata Ravindra. She's also in the film line, and her epilepsy is controlled. So last year we invited both of them for one of our event, and we arranged their interview. Uh, so it was very nice. And nowadays people have started talking about their epilepsy openly.
Right.
Some
Right.
artists, some writers.
Yeah.
So it's nice to see.
Yes, it is
And,
important.
and one more thing I would like to add in Pradnya's point, that nowadays internet affects a lot. I mean, whatever we tell, whatever doctors would tell, they immediately search in their phone.
Hmm.
ये तो ऐसा नहीं है, इसमें तो ऐसा लिखा है, ये मेडिसिन क्यों देते हैं, वो क्यों करते हैं. So they always ask you these questions. So वो बहुत बड़ा बीमारी, बहुत बड़ी बीमारी है ऐसे मुझे लगता है. So we have to believe people, we have to believe doctors, we have to believe counselors, and not to the internet. So that is a big problem nowadays. And one more problem I have seen is changing pathy, because for epilepsy you have to keep patients for years and years for the treatment. But parents, they want their result very quickly. So they again try allopathy, they again try homeopathy, यहाँ गए वहाँ गए. uh, and even if they are well educated, they go to any sadhu or bua, and if they stop the medication and so on. So this education and this awareness is very much needed.
Right. So I do have to, as someone who promotes that, patients should be informed. I don't think the problem is the internet. It's about finding the right sources on the internet. So,
Yes.
I think that's what really we should be talking about. Um, yeah, I think there's one of our attendees has said, I became epileptic from age 18, still living with it. My son is epileptic, but I'm lucky to have never faced any social taboos till today. So that's great. There's a question that has come in, but it's a bit vague, so I'll wait for them um, to respond. You talked of diet, and that brings me to the point, Dr. Pradnya, is there any evidence on the keto diet for epilepsy?
Like I said, about 70-80% of patients will be well controlled on medications, one or two medications, sometimes a third one. The remaining 30%, you're looking at non-medicine options for treatment. What are those options? The first one that has to be explored is epilepsy surgery. But if you find that the epilepsy surgery doesn't suit each and every epilepsy, so the patients who are not what we call surgically remediable, those epilepsies are not surgically remediable. Those are the ones where we talk about the ketogenic diet. It's a well-researched, a very mature form of anti-epileptic treatment. However, it's a medical treatment. So, currently the ketogenic diet has become very popular for weight loss. And, there are a lot of people casually saying, I am doing keto. That's not the keto diet that we refer to when we are using it as treatment for epilepsy. So it's a pretty intense diet. Virtually everything that the child eats is measured and is part of a diet plan that a dietitian has written. There are types of ketogenic diet. There is what we call a classical one. There's something called a modified Atkins and so on. But whichever it gets chosen, and which gets chosen depends on the dialogue between the dietitian, the family, and the doctor.
Right.
But once the dietitian prescribes it, just like if I prescribe 5 ml of an anti-epileptic medicine, nobody even says ki 5.5 do kya 4 do. It's a given that it's 5 ml twice a day. Similarly, when we use a diet for epilepsy, it exactly has to go by the dietitian's prescription. A lot of monitoring goes into, we do blood tests, we do EGs on a daily basis. We are checking the urine to see are ketones being produced. The ratios are getting modified with an aim to have maximal ketones. Seizures are undoubtedly getting monitored. So it's a medical exercise and not a casual thing to do ki sugar ban kiya hai aur keto kar rahe hain. That's but it's a tried and tested. It helps. It works in about 70% of patients. Either reduces the seizures or at least stops the disabling seizures. Many families report that the kids become very active, very alert. Their cognition improves, their mood improves, behavior improves. That's not very quantified, but yes, we see it across that families reporting those outcomes as well. But the main message here is, yes, it's a proven medical treatment, but to be done medically, not to be done casually.
And what is the protocol? So when does a family, or is it the doctor who will say, okay, these medicines are not working, you should try the keto diet, or you should look at surgery? Is that typically left to the neurologist?
Yeah, absolutely. It's the duty, I would say, of the treating doctor, that you are continuously reviewing. Remember, epilepsy is a dynamic disease. It's not a straight line. Even in all epilepsies will have their natural history, which could be very unique to a given patient. So you're continuously reviewing, saying, are the medicines working enough? Is there something else I can do for this child to improve either the epilepsy or the cognition? So it's actually a guideline that by the time the second anti-epileptic drugs looking like it's not working as much as you would like to, you want to consider what's causing the epilepsy and is that cause surgically remediable. If the surgically remediable is proven to be so, then it's epilepsy surgery. No discussion around that. Why? Because it's curative. It's probably the most attractive option when it comes to different treatments within epilepsy. But if a patient's epilepsy is not surgically remediable, then the doctor would check, are other types of surgeries applicable? Is a ketogenic diet applicable? Remember, a 6-year-old, 8-year-old, 10-year-old child who's going to school, to do a ketogenic diet is very difficult. Even if they just go to the neighbor and prasad kha liya, ya बाजू के बच्चे के डब्बे में से कुछ carbohydrates खा लिए, then that's it. Your diet for the day is gone kaput. And so the
so it is difficult to implement.
matching the
Correct.
epilepsy to the treatment is very important, and that's a prerogative of the treating physician.
Right.
So
There's a
post-surgery, Dr. Pradnya, are most people free of medicines, or do they continue on some maintenance kind of medicine?
So there are two types of epilepsy surgeries. One is what we call curative, or we call it technically resective, where we are able to identify the part of the brain where the short circuit is happening, and we are able to identify it and remove it safely without causing any side effects to that patient. That's the epilepsy surgery which is curative. So slowly, a few years after surgery, we slowly start taking medicines off and remove them one by one. There is another type of epilepsy surgery, which is what we call palliative, in which we might do disconnective procedures. We do neuromodulation. We fit devices. We put wires into the brain in the something called a DBS, or a vagal nerve stimulator, which is a device which goes in the chest around the vagal nerve in the neck. So those are surgeries where you're trying to reduce the number of seizures, and hence be able to reduce the number of medicines, not necessarily come off it completely. So in those surgeries, the medicines and the surgery works together. Whereas in the curative surgeries, it's a one-stop destination. You have the surgery, we have proof, we keep checking that the epilepsy is indeed gone away, and then we would slowly come off the medicines and declare the patient cured of epilepsy.
I think there's one question. What are the effects of anti-epileptic drugs if taken for a longer period?
I'm so thankful that somebody's asked this question, because that's such a deep rooted conception in our society, that the longer you take medicines, they're going to cause harm to the liver or the kidney, and of course possibly the brain. So the newer anti-epileptics, remember, you take an anti-epileptic, it gets processed or it gets metabolized just like you food or water we take, and it's out. So, you know, if you miss a couple of doses and you go to check the level of the medicine in your blood, you will find it almost very little or non-existent. The body's processed it and it's gone. So just because you're taking medicines for a longer period of time doesn't mean that you are at a higher risk of experiencing side effects. If you're going to get side effects, they will happen irrespective of the dosage and irrespective of the duration of of the time that you're taking the anti-epileptics for. And if they're happening, they will be apparent. There are no hidden side effects that are going on inside, which aren't obvious. If the patient or the child is doing well, they are doing well. You know, it's very unlikely that the liver is getting damaged inside and you're not coming to know, or the kidneys are getting damaged. So again, when the follow-up happens with the doctor's checking for it, okay, that are there any side effects. But typically, like I said, the newer anti-epileptics are very well tolerated, i.e. the chance of side effects are very less. You don't even need any regular testing to check if any side effects are happening. One thing that happens, like with any other chronic disease, whether it's asthma, diabetes, is bone health can get affected. We typically have these children on calcium or vitamin D supplements, and we'll check it once in a while. But apart from that, serious side effects connected to duration of treatment is a misconception, is a myth, is not a medical reality.
Okay. I think we've covered a lot of questions, unless somebody has any. I'm just checking one final time. I don't think we've addressed all the questions we've received, as far as I can see. Any final words for our audience today? So, okay. Somebody said, I don't know, I guess I have to let you answer this, Dr. Pradnya. Somebody says, mental side effects are very evident though.
Not really. So when I do say side effects, I do mean side effects on systems and on the brain. The newer anti-epileptics, a chance of them causing mental side effects, I assume by mental the person means they're dull or drowsy or depressed, or mood disorders, or awareness, alertness kind of a thing. They're really extremely rare. But if it's happening in a given patient, go back to your doctor, talk to them, and the doctor will be able to change the medicines. Very often the psychology does get affected, and that's, I think, the social problem that we've discussed during the last hour.
Right.
remember, everything that goes wrong, वो bill medicine के नाम पे फटता है. Like, अरे दवा चालू किया उसके बाद ऐसे हुआ, kind of a thing. That's not an uncommon initial reaction. But when we discuss this with parents, when they attend support groups, they do realize that a lot of psychology is the problems with the social perspective, the social taboo in epilepsy.
Right.
Yashoda, you want to add to that?
Yeah. You said about the advice for the people with
Yeah,
epilepsy.
go
No?
ahead. Yeah.
So I think accept your epilepsy, talk openly about your epilepsy, and make a friendship with your epilepsy would be my suggestion. Because each and every person would, if each and every person with epilepsy would start talking openly about their epilepsy and confidently and proudly as we are doing, then there will be a huge awareness about epilepsy in India, I will say.
Right.
Because very few people talk openly about their epilepsy. But so every one of them, see, it is not only for the awareness, it makes confidence in yourself too. You accept yourself, so that changes your life, not only yours but your family's. So accept your epilepsy, talk openly about your epilepsy, and make a friendship with epilepsy. It's that will be my sandesh for this, because
Right.
that will make a huge awareness.
Right. Good. Great. Dr. Pradnya?
My closing words would be medical facts. Epilepsy is a treatable condition. And epilepsy does not stop people from achieving whatever it is that they want to achieve, career-wise, in their personal life. So don't let epilepsy overcome your life. Epilepsy should be just one part of life, like everything else. Like there's finances, there is entertainment, there is career. They all occupy one department in your life. If you have epilepsy, it can't overshadow all these departments. It has to be just that one department. You're looking after it. Do not let it come in way of you achieving anything, because medically we know, and this is robust science, that epilepsy is treatable and you can achieve despite epilepsy.
Right. Great. Thank you. So I think thank you to our panelists, Yashoda and Dr. Pradnya. You have explained, I think, various aspects and facets of the condition. And thank you to the audience for joining, as well as asking your questions and sharing your experiences. And I can't but reiterate what Yashoda said, that I think we all need to accept the conditions we have, talk about it. Let's have more role models from India, and we don't have to rely on the handful that we can count on at the moment. And more importantly, I think the more we share, the more we learn from each other, and the more we realize that it is a manageable condition. So let's do that.
And thank you so much for inviting us here. It was a wonderful time with all of you. And thank you, Patients Engage.
Thank you,
Same here.
Yashoda.
Yeah.
Thanks.
Big thanks. I know you
Thank
dabble in a
you.
lot of diseases, so huge thank you for taking up epilepsy
Yes.
on International Epilepsy Day. Big thanks. I enjoyed this session as much.
Yeah, me too.
Thank you
Thank
so
you
much.
so much for all your encouraging words as well.
Yeah.
I think this should help open up a lot of conversations.
Yes,
Yes,
absolutely.
I hope so too. And maybe we'll
Yeah.
do more then. So,
Yes.
We should, yes.
all right. Thank
Thank
you.
you.
Thank you,
Thank
everyone.
you.
Bye.
Thank you.
Thanks. Bye.
Good night. Thank you.
Good night.